My name is Jason Schuster, and I'm a doctor of physical therapy. The information, mindset, and standards of care medical practitioners learn in school and implement in practice are outdated and objectively failing. Nutrition, supplementation, peptide therapy, and how they affect the epigenome are almost completely absent from medical schooling and mainstream practice. 50% of the United States population is deficient in 6 of 7 key vitamins and nutrients required to maintain health. 80% is overweight, and the average life expectancy is decreasing for the first time in a century. These courses will provide you with the information you need to fill this gap in medical schooling and mainstream practice based on the most up-to-date, peer-reviewed research, giving you the tools that you need to improve your health and the health of your patients. If you can get your kids doing this or children doing this from a young age, that is the key, right? If you spent your whole childhood eating crap, it's totally reversible, but it's going to be a lot harder because your epigenome is going to be altered already from the crap that you're putting into your body from when you're a little kid, right? So again, for all the parents out there, this stuff is super duper important for your children too. If your kids are eating Doritos every day, that is literally like eating rat poison. Your body views it as the same type of thing, as poison, right? Ultra processed food has been processed down from, so you start with some type of real thing, and then they emulsify it and they distill it and they do all this crazy stuff with it, with butane and gasoline, and to get all the stuff out there. By the time it's been processed so far, like a Twinkie, nothing about a Twinkie your body recognizes as food at all, right? It's just a big sugar rush, and added sugar is also poison to human beings, right? So that stuff is literally eating poison. It's hard to wrap your brain around this because a lot of people, most United States people, most Americans, the vast majority of their diet is ultra processed food. So it shouldn't be surprising to anybody that the health of the country is in the toilet, because most people are eating most of their food as ultra processed food, which is poison. So nothing good happens from eating poison every day, and that is what is going on, right? So if your goal is to be overweight, obese, morbidly obese, eat stuff on list 4 like the vast majority of Americans do. If you want to be healthy and not have to go to the doctor and be in good mental and physical condition for life, don't eat processed foods. That is the #1 easiest thing to do for people to get healthier, is stop eating processed foods. So here's the NOVA classification system, right? So group 1, unprocessed or minimally processed foods. So you have to take some of this with a grain of salt, right? So when I say ultra processed foods, I'm not talking about canned beans with like salt in them, right? Or canned tuna fish. Like, that's obviously processed, but it's about as minimally processed as you can get, right? Ideally, you want no processing, but that's pretty hard to do for most people. So minimally processed foods, canned beans with salt in them are totally fine. Tuna and stuff like that if it's wild caught, right? But you really want to try to keep as much of the stuff that you put into your body on list 1 as possible and minimize everything else, and try to totally get rid of list 4, right? So in group 1, we got natural, packaged, cut or chilled frozen vegetables, stuff like that, bulk grains, and we'll get into grains in a little bit here. Right, I'm not going to go through the whole list, but you guys can look through this list. It's basically try to keep stuff as natural as you can. So think about where it came from, how many things need to be done to it to make it into the form that you're eating, right? And you want as few steps from the natural process to what you're eating as possible, right? Group 2, oils, fats, salt, and sugar, right? You want to remove as much of that stuff as you can. Oils are good. We'll get into what oils we should be eating here in a second. Just real quickly, coconut oil and olive oil seem to be the best oils to eat, and we'll talk about why in a second, right? Here's list 3 and list 4. So again, you want to try to remove stuff from, you want to try to remove everything from list 4. You want to try to eat mostly stuff on list 1 and list 2, and so 2 is better than 3, 3 is better than 4. So again, try to eat most of your stuff on list 1 and minimize the other stuff. But this is a very, very good thing to give patients because, again, just based off the medical schooling in our country and the way the mainstream medical system works, which is more or less criminal, most people do not understand this stuff even a little bit, right? They don't understand why eating Doritos is not good for you. And you really can't blame these people, right? It's never been told to them. And unless they have the interest or the curiosity to look online, which is very, very easy to do, right? All of this stuff is available online, but you don't know the quality of the information you're getting. You don't know who you're getting it from. So it's just very confusing for most people, right? So this is why we can really, really take advantage of this, and you can set yourself apart from other medical practitioners by improving your patient's health more, by knowing more good stuff about medicine, right? Okay, so this is the NHANES studies. So the NHANES studies are, I guess, they're our best guesstimation of what the general population is deficient in as far as vitamins and minerals and nutrients go, right? So this NHANES study, the most recent one, 2005 to 2016. So again, you got to take this with a grain of salt, because the way they do these are surveys, right? So they basically call up a bunch of people and they ask them what they ate in the last 2 days. They give them a survey, they have them fill it out, and then from that they derive the amount of nutrients and minerals and vitamins that people are getting, and then they extrapolate it to the whole population, right? So this NHANES study was done on 26,282 adults over 19 years old from 2005 to 2016, and they're basically looking at the main primary vitamins and minerals that people need in their body to have an homeostatic autonomic nervous system. And the outcome of this study is absolutely devastating, right? So per the CDC at least, the main nutrients that people need to be able to have everything else go good, and this is not absolutely true by any stretch of the imagination, but this is a good start, right? So the RDA and the EAR are two terms that people probably haven't heard about. The EAR, the RDA is everybody has heard of, and we'll talk about that on the next page because that is a mess as well. But okay, so this is disturbing. So even people that think they're eating healthy, a lot of them are very, very deficient in major primary nutrients and minerals that they need in their body for our cells to function normally, for ATPs to get made normally, right? So in this study, 45% of the US population is deficient in vitamin A. 46% of the US population is deficient in vitamin D, or vitamin C. 95% of the US population is deficient in vitamin D. This is a massive problem, right? Vitamin D, all these vitamins are essential for normal cellular function. If 95% of the United States population is deficient in vitamin D, that basically means that there is no way that 95% of the US population can be healthy. It's impossible. If you have low vitamin D levels, you are not going to be healthy, period. End of story. There's no question about that, right? Again, this is why we see 80% of the United States, 79% of the United States population is overweight, obese, or morbidly obese. That is unacceptable.